Go.
Hello everyone, my name is Rachel Richards. I'm a physical therapist at Ability Physical Therapy in Marion, Iowa. Today, what we want to talk about is posture and posture progression in order to help maintain alignment throughout your day while sitting. Whenever I start with my patients, when we talk about posture, I always want to start at the feet. I want your feet to be about hip width apart, not turned outward, not turned inward, just maintaining that good stable position. Knee bends, obviously, and then we come up to your pelvis. Now, with my hands on my pelvis right now, what I try to imagine is that my pelvis is a bowl of water. I'll bring my hands out like this. With my bowl of water, I could tip my bowl of water forward and tip it backwards. Coming back to the pelvis, you're still going to imagine that bowl of water, and you're going to roll your hips forward and roll your hips backwards. I'm going to turn so that you can see. Here's my bowl of water, and I'm going to roll my hips forward and roll my hips backwards. It's really hard to coordinate this the first time, so don't get frustrated, but we are trying to feel the way that our pelvis moves against our lumbar spine. So as we roll forward and backwards, I just want you to feel for that movement without letting your shoulders go downward or backwards. Just at your pelvis. And back forward. Let's go ahead and do that about 10 times as we kind of feel for that motion and getting a little bit more control. As you get a little bit more comfortable with this movement, I want you to start feeling for where are your sit bones. By sit bones, I mean those little bony butt bones that we all like to sit on. That's where we should be sitting, right in the middle. So I'm not all the way forward, I'm not all the way backwards, but I'm about halfway in between, right on those sit bones. Okay? The next step, I'm going to have my hands on my thighs, and what I'm going to do is I'm going to squeeze my belly, squeeze my abdominal area. This provides a good platform for the rest of my posture. So I'm still on my sit bones, and I have my belly squeezed nice and tight. From there, we want to squeeze our shoulder blades down and back. Notice I did not come upward or anything else. They went in a downward and backward position. From here, we just do what's called a chin tuck, where I take my chin backwards. Now, this looks strange. You don't want to go all the way back here, but you want to relax those muscles right here and maintain that upright alignment. I'm going to turn so that you can see it from the side. We're going to start at our hips and roll forward and backwards, and then find our sit bones. We're going to squeeze our belly muscles nice and tight, squeeze our shoulder blades down and back, and then chin tuck backwards so that my ear is aligned with my shoulder and aligned with my hip. This is ideally where we should be sitting at all times. It feels weird the first few times that you do it, and you will find that you get here and then a few minutes later you're back to your normal sitting posture. What you need to do is always just be counting 1, 2, 3, 4. If you can do that throughout your day, my suggestion is about every 10-15 minutes rechecking your posture. Count 1, 2, 3, 4, and then you go about with your work. Whether you're typing, reaching, whatever you're doing, maintaining this posture helps to keep your spine in its appropriate alignment, allowing all of your tissues to be loaded how they're built to be loaded, as opposed to wearing and tearing on structures that just aren't built to take those forces. So that is the posture progression. Leave a comment if you have any questions.